We live in a world where we have more access to food than ever. Yes, more people are nutrient deficient than ever in history. Our soil is depleted, our lifestyle are stressful, and our diets are often full of calories, but empty of the real nutrients. Today, I want to reframe how we think about supplements, not as pills for sick people, but as nutrients insurance for modern living. I'm Dr. Chen with Optimal Chiro-Rehab Center, and my mission is to help you understand your body so you can take control of your health naturally. Over 90% of Americans don't meet recommended daily intakes for key vitamins and minerals. Modern agriculture and food processing have drastically reduced nutrient density. For example, a vegetable grows 50 years ago had 30 to 70% more vitamins and minerals. Environmental stressor, pollution, lack of sunlight, chronic stress increase nutrient demand. Chiropractic and rehab patients especially benefit from optimized nutrients for tissues repair, inflammation control, and recovery. Think of your nutrient as a raw material for your body to use to build and repair itself. Without the right material, even the best treatment plan can't work at full potential. We've been conditioned to view anything in capsule form as drug, but nutrients don't treat disease, they feed your body. Supplements simply bridge the gap between your body needs and the diet we can provide. It's not about taking a pill to fix a problem, it's about giving your body the building block it's missing so it can fix itself. And here's an example: vitamin D, magnesium, omega-3 are nutrients, not drugs. The body uses them daily for energy, brain function, and repair. If your body is a construction site, supplements aren't the worker. They are the brick, the cement, and the steel. You still need skilled worker, your metabolism, recovery, exercise. But without material, no building gets built. The goal isn't to take everything under the sun, it's to fill your unique gaps. Get your baseline checked. Blood work, symptom tracking, professional guidance are the key. Look for bioavailable form, third-party testing, and real food-based ingredients. So when it comes to choosing your supplements, the key here is getting the right supplement for you, but also the quality of the supplement is extremely important. The way it's processed and where it came from. So there's no such thing as cheap and good. So make sure when you get your supplements, know who made it, where it came from, and how it was processed. It's not about perfection, it's about consistency. Pair supplement with real foods. A good breakfast, hydration, movement, amplify their effects. Building a routine that supports your nervous system, recovery, and resilience, not just your muscle. As a chiropractor, I focus on alignment and functions. Nutritional align your internal chemistry the same way adjustment align your spine. Realistically, we do not realign your spine. We unlock the blockages, the joint that's stuck because of overused muscle. Lock them up, they don't move. So remember, supplements aren't medicine. They are a food and they are a necessity. It's not an option, it's not a choice. And sadly, the world are changing faster than our biology. Human body have been the same for the last, thousands of years, million of years, right? But our food had changed drastically. Some of the things are better the way they used to be. So eat the whole food, whole grain. Same thing, take your supplement because it's not a choice, it's a necessity. If you want to know what nutrient your body needs the most, book a wellness consultation with a professional. A nutritionist, they have tests that they can do for you, but make sure you go to somebody professional. They should be able to help you. If you live close by here, we can help you as well.